Good evening, everyone. I'm Teresa Blondin, the Director of Volunteers and Programs at Bladder Cancer Canada. Thank you so much for joining us this evening for the webinar, Navigating Relationships and Intimacy with Bladder Cancer. During this session, we will discuss relationships, intimacy, self-perception, and dating after a bladder cancer diagnosis, and then we'll move on to a Q&A session. I'm honored to welcome you tonight to break the taboo and normalize this essential aspect of life. And please remember that the content of this webinar is for informational purposes only and should not be considered medical advice. Always talk to your doctor and/or urologist about what is best for you. And now I'm honored to introduce our speaker for the evening, Emmanuelle Bachand. Emmanuelle will soon graduate with a bachelor's degree in sexology from the University of Quebec in Montreal. She's currently interning in the Oncology Department at the Jewish General Hospital in Montreal, where she works specifically on sexuality of cancer patients. In her internship, she has created a webinar on libido and cancer and conducts individual follow-up sessions with people facing relationships and sexual difficulties related to the illness. She's particularly interested in sexual pleasure, romantic relationships, and sexual dysfunctions. Emmanuelle is eager to get involved in community organizations to help people living with cancer regain a satisfying sexuality. So thank you so much for being here tonight, and the floor is yours.
Hi, everyone. Thank you so much for inviting me and being here today. So I'll just set up this. My name is Emmanuelle, and I've been an intern at the Jewish General Hospital. I've been in oncology for a few months, so it's still something new. It's still a subject that's also really hard to learn online. There's not a lot of information about sexuality and cancer to learn. I haven't had any classes on these subjects. So it's possible that today I say things that don't necessarily relate to your experiences. So that's why I would really appreciate if at the end of the webinar, we have discussions and you can really share about your experiences or any questions or critiques as well, so that we can learn more about these subjects that is really important in our life. So today I prepared a webinar on relationship, intimacy, and with bladder cancer. And we will be talking about body image. We will be talking about relationships, celibacy, and dating. We will see some of the consequences on sexuality due to the treatments and the cancer. And then we will see a few solutions to be able to relearn sexuality dealing with cancer. When I talk about solutions, it's things that need some effort, need some time. It's things that might work for some people and not work for others. And it's also really important to know that there's no magic pill. It might take a lot of time, it might take a lot of efforts, but it's things to explore and things that could make you able to live your sexuality in new ways and things that you maybe haven't thought of before. And then we'll have a time for discussion and questions. So the first subject I wanted to approach is body image. I think this is a really important topic when it comes to cancer because due to the treatments, there's so many changes on your body. And a lot of people feel like a sense of betrayal or detachment to their body when it comes to the changes that they're going through. And a lot of people will feel some negative body image. And this has a lot of impact, not only on your relationships with others, but about your own confidence, your sexuality, the way you feel about your personality even. And it's really important to address it because it could really, really help you go through the treatments better as well. Because you feel more confident, you have a better mental health, and you'll be able to get healthier faster as well. There is a few possible solutions to get a better body image. And first of all, it's to surround yourself with positive and realistic representation of bodies and people who make you feel good. It's important to really take a moment to think about the people who you're surrounding yourself with and to choose the people who don't put as much attention to the physical part of yourself. People who make you feel important, people who make you feel like your value is really about your personality and not necessarily about your body. To really focus on people who talk in a positive way about their own selves as well. And sometimes just to hear positive speech of others around you make you really feel better about yourself, even when these people are talking about their own selves or about you. If you have close friends who you really feel you can really trust, you can also ask them to describe what they like about your body and your personality in a positive and honest way. It might feel weird to do that, but sometimes just to have another perspective on yourself and to see that the people who really like you, they normally like you for more than just what you look like. And if something about your body if there's something about your body that you really don't like, or you feel like you're losing confidence because of that, then maybe you'll see that your friend hasn't even seen that you changed something about yourself, or it might seem huge for you, but so little for the others. And sometimes to ask them, then you'll be able to talk about it. And sometimes you realize that they really haven't seen any of the changes that you're thinking about so often. It's also possible to attend support groups or to read about people who went through similar experiences than you did, and sometimes to just not feel so alone in this, because it's normally things that we don't normally talk about. And sometimes it's also hard to find the right words or to feel like you can really open about these issues, because it's really hard to share. And sometimes just to hear about other people going through the same things could make you feel way much better. But the most important thing when it comes to body image is really your inner speech. When we don't feel good about ourselves, we tend to have a really negative speech about ourselves. We tend to think in a negative way, or to say things that are negative about our bodies to others as well. And the more you talk in a negative way about yourself, the more you'll feel negative about yourself as well. It really is a vicious cycle. So you need to break this cycle by talking in a more positive way about your body and your personality, and being more compassionate with yourself. Even if you don't believe that you look good, even if you don't believe that your value is as important, even if your body change, just to find the sentences in your head and to say them again and again, then your brain is going to start to believe it, even if you at first you really didn't think that was something that's possible. And sometimes it's really hard to be compassionate with ourselves, and something that you could try to really get a new perspective and realize how uh, mean we can be sometimes with the things that we say, is to get an old uh, photo album of yourself. Find a picture of yourself when you were 7 years old, for example, and see yourself as if it's you, and say the things that you used to say about yourself to that person, that kid. And sometimes it makes you realize how mean you could be, and how important it is to accept that this person has still so much more value, even if they've been through so many changes. And it really makes you realize how being kind and is important, and to talk about yourself as if you would talk to that same person but younger, or to talk about yourself as if you were talking to a close friend, for example. And it's really important to give yourself time, because it does get better. It's so many drastic changes all at once. Not a lot of people are going through that many changes that fast. So it's normal that you feel a little bit lost about it. It's normal that you're not thinking in a positive way, and that feels really hard to think in a positive way. But just take the time to really digest it, and you'll get used to it with time. So next up, I'll talk a little bit about relationships. Some couples, when it comes to cancer, get closer because they get to know each other. They get to really be there for each other and learn new parts of each other. But some will distance themselves or have more conflict due to cancer. It's possible that one or both partners have a sense of guilt or a feeling of frustration, sadness. It's possible that partners decide to isolate themselves in the relationship. And it's something that's also normal, because you're both evolving, you're both changing, you're both going through something that you've never been through before, or maybe you've been through before, but not with that person necessarily, or like this. And it is a really challenging time. So just know that communication is the key. It's so, so important to really talk with your partner and talk about what you're going through, what you need right now. And even if you don't know what you need or you don't know what's going on, it's really, really important to take the time to connect and really be open about how you're feeling. Even if you don't know how you're feeling, just say that you don't know how you're feeling right now. And if you're really lost with your emotions, maybe take some time alone, write them down, think about what's going on, and take the time to really find the right words. Maybe say them out loud when you're by yourself, and then communicate them with your partner. And it's also really important to preserve quality time. Sometimes when you're going through cancer, the other partner becomes a caregiver, and you kind of lose the sense of why you're together because there's always one person taking care of the other, or you feel like you're being a burden, or you feel like you're so heavy on the shoulder of someone else, and you kind of lose the loving relationship, and it's more of a caregiver relationship. So you really need to take some time to plan activities in your month where you can really just be together as a loving relationship, or you can just not talk about cancer, not talk about negative things going on in your life or your problems or your finance and stuff like that, and just really take some time to have pleasure together. Like it doesn't have to be big activities. It could just be to watch a movie together without having big conversations. And it's also important to use the support of friends and family and take some time apart. You need to have connection with other people as well, and you need to have conversations with them so that when you go back to your relationship, then you have new things to say and you can really be yourself because you have other things to share with your partner. And if you think that you're a little bit lost in your relationship, it's also possible to consult a therapist or a sexologist or to discuss with people who went through similar experiences. I'm sure you're not alone in what you're going through, but it is case to case. So maybe sometimes to go both see a therapist and share, maybe you'll realize a few things are easier to change in your relationship, and that could make it so much better. And then for the people who are not in a relationship, it's also important to talk about celibacy and dating. Sometimes people who are going through cancer really, really feel alone if they don't have a partner. And sometimes we hear that they feel like they'll never be able to meet someone with what they're going through. Some people have the fear of meeting new people as well. It might be because they're scared of having to disclose the cancer, or they feel like they're too much. But it's really important to recognize that everyone has their own baggage. When you start dating, most people just think about their own life, their own problems or issues, and they're scared of sharing them with you. And sometimes your own baggage seems so big, but the other person is really just thinking about their own things, and they might not see your baggage as something that is as big as you think it is. Also, when meeting new people, it's important to start slow by, for example, grabbing a coffee or taking a walk, and you don't necessarily have to put pressure on yourself to do more or go any further. Uh, Sometimes you might be scared of meeting someone new because you think that you might not be ready to have enough energy to see someone often, or to really create a relationship, or to get to know someone new. But it doesn't going on a walk or getting coffee doesn't mean that you need to engage in a lot of meetings after that, or that you really need to get to know that person a lot. You don't owe them anything. And by putting pressure on yourself, it's also harder to really be yourself and to have fun, because you're only focused on if that person is going to be good for you or not, or if you're good enough for that person or not. So really just focus on maybe having fun or just getting to know someone for one day, for example, and then you might see that you could get some fun out of that. And you can also have fun just flirting, or getting to know your own self by presenting yourself as well. If you're scared of disclosing the cancer, you can also practice with a friend beforehand. Sometimes just to give a chance to find the right words and say them out loud to someone else and let them ask questions about what you're saying as well can help you be more um make it easier when you're going to disclose it with someone that's new or important to you. And when it's time to disclose it, don't put too much pressure on yourself to say the whole story or every details. You can just start by saying that it happened to you, that you had cancer, and then just let them digest it. You don't have to fill in the silence if there's one. You can just let them ask their own questions and go slow, telling them about it. You don't have to say everything all at once or be super honest about what you went through either. And if you're single, there's also other ways to meet your emotional needs. Sometimes we think that single people are really lonely or sad, or that being in a relationship is so much important because we put so much attention to relationships in our society. But a lot of people who are single have even more connections than people who are in a relationship. They are more connected to their community, they have more friends, they are more connected with their family. So it doesn't mean that you're lonely, it's really mostly a mindset. And if you think that you feel lonely, maybe it's because you're not really connecting with the people around you, or maybe you're missing physical touch as well or an emotional connection, but these are things that you could find in your relationship that you have right now. For example, when you're seeing your friends, take the time to give them a hug or sit close to them when you're watching a movie together, or have a more profound communication conversation with them. And there's ways that you can just feel connected to people and have physical touch. That's really, really important because your body, when you get physical touch, you create oxytocin, which is the hormone of touch. And sometimes when you haven't had that hormone for a long time, then you feel really lonely and sad. So it's really easy to just create that hormone by, you can even touch yourself. For example, give yourself a massage when you're alone at night, for example, and then your body will create that hormone and you will feel less lonely as well. And then about intimacy and sexuality, I think it's really important to talk about sexuality when it comes to cancer because it's something that's really not talked about a lot. Uh, Sexuality is a subject that's taboo in general, but even more when it comes to cancer, even more when it comes to bladder cancer, for example. The people from the hospital, they don't I think they have the best intentions, but they just don't have the right education about these subjects because there's no classes about these subjects, and it's also really hard to talk about it because it's really taboo. We don't know what words to use, and even as patients, it's hard to talk about your sexual difficulties because you feel like it's not a really approach at the hospital, and it's not something that seems important, but it really is. And sometimes it's so hard to share about your personal life because it feels so intimate to share about these things. But sexuality is something that's so important, and it's part of your health. It's part of your mental health, your psychological health. It helps you be more connected to others, to be more confident. It's so much more than just sexual relations. And when we talk about sexuality, people tend to think that it's only about sexual relations, or but it's really much more than that. It's how you feel about yourself. It's your identity. And sometimes with cancer and its treatments, actually most of the time, it has a lot of impacts on your sexuality, on your sexual function. It's possible that you're dealing with erectile difficulties or difficulty reaching orgasm or feeling pleasure. Maybe you're going through vaginal atrophy with that means that the vagina gets smaller, which causes dryness or pain during penetration. It's possible that you're living with incontinence or having to wear a stoma that makes you more uncomfortable during sexual relations. You might be dealing with low desire as well because of the chemo or the surgery and the hormonotherapy. And there's also so many consequences that are related to a negative body image or the feelings of depression, anxiety, and fatigue that are all related to cancer and its treatments as well. So to be able to relearn sexuality, it's really important to, first of all, break some myths about sexuality. Like I said before, and I keep on saying, when we talk about sexuality, we always think about sexual relations. But even when we talk about sexual relations, we tend to think only about penetration as well. But sexual relations are much more than that. It's masturbation, it's oral sex, it's just erotic massage could count as a sexual relations as well. It's not because you cannot do penetration anymore that you cannot respond to your needs, your sexual needs. There's so many ways to do it, but you just need to explore more to be able to find the things that work for you. Sometimes as well, we think that sexual desire and sexual arousal are the same things. Uh, Cancer has an impact on libido, and when we talk about libido, we tend to think that it means that you'll get less desire and less arousal, but most of the time it's mostly just less arousal. But when we have less arousal, we think that it means we have less desire, but not necessarily, because sexual desire is just your a subjective desire to go into a sexual relation. It could be because you want to get sexual pleasure, or you want to feel close to someone, or you want to give pleasure to someone else as well. And sexual arousal is the sexual manifestations of arousal, like for example, having an erection or being uh, having lubrication or feeling hot. But sometimes cancer has an impact on arousal. And when you think that you don't have arousal, you think that you don't have desire. But you could still have desire and no arousal and have a really fulfilling sexuality. So don't stop yourself just because your body doesn't respond like before. Even if you have desire, that's the most important thing. But it's also important to know that if you don't have desire, to not get into a sexual relation. Because if you force yourself to do it, even though you don't want to do it, to give pleasure to someone else, for example, then your brain's going to associate the sexuality as something that's a core, something that's not pleasant, or something that you don't want to do, but you have to. And then your desire will go even lower. And then another myth that's important to break is the one that we think that sickness or aging makes you asexual, that old people, for example, don't have any desire or don't have any sexuality. And sometimes these myths are so strong that even if you have desire, thinking that older people or sick people don't have desire makes you believe that you're not supposed to have it, and then you kind of give up on having a sexuality. So just know that it doesn't mean anything, and a lot of people who are older have more sexuality than younger people, or people who are sick even have more sexual desire than people who are really healthy. It's really a case to case, and it doesn't mean anything if you're going through things. Maybe sometimes having more time or being closer to someone just gives you more desire, and it's not even if you're going through cancer or you're aging, for example. And then another myth is to think that erection is the center of every sexual relations. In our society, we put so much attention into having an erection and so much attention on genitals. But like I said, even if you cannot do penetration anymore, you can do so many more things. And we also tend to think that if you cannot have an erection, that means you cannot have sexual pleasure, you cannot have penetration, but that's not true. You could still have no erection, but you can have sexual pleasure. You can do penetration. You can have an orgasm. You can ejaculate. Your genitals still work, even though if it's not as erected as it used to be. And then there's also the romanticization of spontaneity and non-communication. Sometimes, for example, in movies, we tend to see people who just get together super quickly, and then their sexual desire and arousal comes together all at once, and they all know what to do without communicating at all. But sexuality is so much better when we take the time to communicate what we like, what we don't like, and when we plan it. Our it doesn't have to be spontaneous. Sometimes sexual arousal takes a lot of time to come, and even sexual desire. So just focus on intimacy before, and then see if the sexuality comes in later, and take the time to put the effort to find the sexual desire and the sexual arousal, because it's not just spontaneous like it is in the movies, for example. And then I put a study that found the two common factors found in couples who have maintained satisfactory sexuality despite cancer and its treatments. And they found out that the number one was communication. If the couples were communicating when something hurted, when they wanted to try something new, for example. And the second was the non-association of sexuality with penetration. So these couples were able to still feel sexual even though they weren't having any penetrative sex. They still had oral sex, for example. They still have a lot of intimacy together. They still have masturbation and stuff like that. So they still feel connected sexually, and they didn't put so much pressure on having penetrative sex. And then the final myth, I think, is the most important one, is to think that the genitals are the most important sexual organ, but that causes that many people decide to give up sexual relations when faced with difficulties related with cancer, such as erectile dysfunction, vaginal dryness, or pain during penetration. But yet the two most essential organs in the field of sexuality are still intact, and they're the brain and the eyes. But when you're always focused on your genitals, you cannot be in the present moment because you're anxious about if your body's going to work like it used to before, or if you're going to get pleasure or not. But to really be in the moment and to enjoy what you're going through and have your body respond, you need to actually be relaxed and have fun. And that all happens in the brain and your eyes as well. So you need to focus on the things that make you aroused and not focus on the bad things about your sexual function. If you're always thinking about if your genitals are going to respond, or the fact that your genitals are not responding like they used to, then you'll never be able to actually make them respond because your brain's not going to be in the moment, and then your brain controls your genitals. So if you can be in the moment present and really just focus on having pleasure and being connected with others and looking at things that make you aroused, then maybe you'll find out that your genitals will respond because of you being in the moment. And then I keep on talking about communication, about sexuality, but I understand how hard it is to talk about these subjects with someone. These are not things that we are used to talk about, and we never get to practice talking about it because no one talks about it in our society. It's always things that we keep really in the close relationships, and sometimes you share a part of yourself that's so intimate can be really, really hard. So how to communicate a sexual difficulty with a new person or in a couple? First of all, you can just start by asking the other person about their own preferences and desires. And then maybe you'll find out that this person has things in common with you, or that person will just ask you and you at the end, and then you'll be able to share about your own preferences and desires. It's also important to know that there's things that need to be talked about in bed, and there's other subjects that should not be talked in bed, but should be talked about at the kitchen table, for example. If you really want to share something that's a little bit more negative about your sexuality or your relationship, maybe take the time to plan a moment outside of the bedroom to talk about it, and not talk about it when you're in bed close or when you're thinking of having a sexual relation, for example, because your brain makes associations. So if you have a conversation that's really hard to have, or something that makes you have like negative feelings, then you might associate being in bed and having sex with that kind of communication and that kind of conversations and feelings, and then you'll just have less desire to get into a sexual relations because you'll keep on thinking about these kind of conversations. But it's also important to have communication in bed, because if something that's happening that you don't like, you really need to say it. Because then again, if you're having a bad sexual relation or something that you're really not enjoying, your brain is also going to make the association of something bad with sexuality. If you need to bring up this subject of sexuality and you're having a hard time with it, or there's something new that you really want to try, but you feel shameful talking about that with your partner, maybe put the blame on something on or someone else, like this webinar or just a pamphlet that you saw at the hospital. For example, you could, if you're going through a sexual difficulty, you could just say to your partner that you were in the waiting room, you saw a pamphlet that talked about that sexual difficulty related to your own treatments, and that you really wanted to say it to your partner or the person you're with, to be able to really feel close to them and be more comfortable when it comes to sexuality. And then it's really important to recognize your emotions related to the subject and to disclose them by taking some time apart and really taking the time to realize what you're going through, saying the words out loud, and also to be able to say the real things. So when you're really feeling confused, then you can just say that to the other person. But taking some time apart can make you realize what your real emotions are before you talk to that other person. And then to relearn sexuality, it's really important to rediscover our bodies. Just like the first time that we discovered our bodies with, for example, with masturbation, it could be by your own self or with someone else. You could be masturbating someone else or masturbating yourself with someone else. And that is really important. Masturbation is super, super important because it helps you relearn what feels good, what hurts, what's uncomfortable. It helps you reappropriate your own body and your sexuality of the changes created by the cancer and its treatments. And it helps you have a more positive body image because you're seeing your body and you're exploring it, and um, you're also able to communicate with the person that's next to you and feel more comfortable with rediscovering your sexuality together and relearning what's good. And you can even share what you like about the way you're touching yourself with the person that's next to you. And then a second practice that could be really, really useful to do with someone else or by yourself is sensate focus. If you want to know more about that practice, you can always look online. There's so many examples and so many explanations on how to do it. But it really consists of separating sexuality in small steps and adding constraints at every step. I'll do an example. So you could separate sexuality in 5 different meetings. You can have one meeting on the first night with someone where you're spending 40 minutes together, and you have 20 minutes on one person and 20 minutes on the other person, and just focusing on giving pleasure to the person that has their 20 minutes. And when I talk about constraints, what I mean is, for example, on the first meeting, you cannot remove your clothes. And then you need to be touched or touch someone else with their clothes for 20 minutes. So that way you really explore new things because you don't have many things that you can do. And you can communicate what you like, what you don't like. You can feel more comfortable if you have body image issues at the moment or if something hurts. And the most important thing is that it removes pressure to go further. If you're really scared of not getting an erection or having pain during penetration, then you don't really have to think about that because you cannot go over in those steps because you really cannot go further. You cannot remove your clothes. So you remove pressure of going further. You can really be in the moment present because you're only focusing on one person at a time. And then on the second meeting, you're doing the same thing, but with less constraints. So you can remove your clothes, keep your underwear, and then on the third meeting, you could just remove all of your underwear, but you can only touch them with your mouth or with your hands, for example. And then on the last meeting, you can do whatever you want. And that way it really makes it easier to connect with your brain because you're really being in the moment present. There's no pressure of going further. Even if your body doesn't respond, it really doesn't matter because you cannot really use it right now. And even if it does respond, do not go further. Just even if it's the first time in months that your body has responded, really, really respect the constraints and do not have the sexual relations that you wanted so badly. And it can really be different for every person. It could really be just by yourself, giving yourself constraints and not putting too much pressure on yourself when you're masturbating, for example. And there's so many examples online. And then the next one is a few possible solutions to improve the quality instead of the quantity of the sexual relations. And it's all about being creative. We tend to really have the same sexual script all the time, and we really have a routine when we've been with the same person for a long time. But it's really important to think outside the box and try new things because maybe the things that you used to do doesn't really work anymore, so you need to find new ways of enjoying yourself. It could be about changing environments, like having sex in the shower, the bath, or different rooms. It could be using games, toys, erotic contents, creating an environment that is suitable for relaxation and pleasure. It could be about keeping pieces of clothing on or dimming the lights if you're dealing with body image issues, maybe to just hide that part of yourself that you don't feel confident yet about, so that way you can really be in the moment and not just think about how you look. And it's really important to promote intimacy as well, so that you do massages, baths, showers, that you hug, you cuddle, you get deep conversations. It could be about sharing your sexual desires or fantasies together. And sometimes just having a really intense conversation could be kind of like a sexual relations because you feel really connected to the other one and you can get aroused by just having conversations as well. And there's also the balance of inhibitors and exciters. That's an exercise that you could do when you're with someone else or by yourself as well. And it's just to take a piece of paper and put one side where you put all of the things that you normally enjoy when you have a good sexual relations. It could be, for example, that you tend to have better sexual relations when you feel loved or when there's a romantic atmosphere or when you've had a nice day, when it's silence or when there's nobody at home. And then another side where you put all of the things that normally make you feel less sexual, or for example, like being stressed or not feeling attractive, being tired, having couple conflicts. And then doing that, you really get to think about the things that you like and you don't like, and doing it with someone else, and you can see what goes together and what doesn't. And the person that has the less desires or the less pleasure right now with sexual relations, that you can put all of the good things and really take the time to prepare the best environments and put all of the chances on your side. It's also possible to keep a diary of the times when desire is highest or lowest. If you're dealing with low desire, for example, you could really take a piece of paper, and every time that you have a sexual thought, for example, it's possible that with your menstrual cycle that you realize that at the beginning of the month you normally have a lot of sexual thought, and at the end of the month there's no sexual thought at all. Then write that down, and then when your highest desire is, then you can plan your sexual relations in advance when your desire is at its highest. And then add all of the exciters that you'd put at the balance, and then you'll have every chance on your side. It could also be a diary about your incontinence. If you see that in the morning you tend to have less incontinence, or it's at night, then really plan your sexual relations at these moments. And then one of the most important things is to be in the moment, the present moment, like I said before. And how to do that, there's one practice that's really helpful, and it's called mindfulness. I'm sure you've probably heard about it. It's something that could be practiced all the time as well, and it really helps with better sleep, with less anxiety and less depression. And it's all about paying attention to the present moment. It's about thinking about the physical sensations like textures, temperatures, smells, or what you're seeing, and accepting that it's possible that you might have thoughts about something else, to accept them, but let them go and go back to focusing on what you're feeling right now. And that's something that could be practiced in your daily activities. For example, when you're doing the dishes, you could focus on the feeling of the soap on your hands, or the feeling of the hot water on your hands. And whenever you're thinking about something that happened during the day, then you accept it, but you go back to the feeling of the soap and the hot water. And the more you do it in your daily activities, the better you'll get at it, and the easier it'll be to get that mindfulness into your sexual relations as well. And then just really focus on the sensations. That way your brain's going to be in the present moment, and you'll also feel more sensations, because you'll be more able to focus on what your body is feeling. If you're interested in learning more about this subject, there's the book Better Sex Through Mindfulness. That's really, really interesting. And they talk about a group of women who had a sickness that made them feel less sensations to their body and less connected to their sexuality. And then they practiced mindfulness for a few months, and they had a lot of benefits, and they felt way better at the end. So it's really interesting. And then number 6 is to find solutions to face challenges related to sexual function. I've put a few of the sexual difficulties and a few tips that you could try to maybe get better with these. So the first one is related to erection. Like I said before, the biggest enemy of erection is anxiety. It's really important to practice mindfulness and state focus if you're dealing with erectile dysfunctions, and because it helps you to reduce the pressure to achieve an erection. If you're only thinking about getting an erection, the chances are you're not going to get one. You really need to put less pressure on that part and really think about enjoying yourself in other ways, and that's how your erection will come, and you'll have more fun as well. After surgery, it's also important to masturbate as much as you can if you to help repair tissues, and then increase sensations if you have scars. You could also try a penis ring, for example. That's the images I put in the PowerPoint. It could be placed anywhere like on the image, and it helps to keep the blood in the penis. So you need to have a some a little bit of erection so that can really help, because the blood has to go first in the penis, and then the penis ring is going to keep it there, and it's going to make it tighter, so the penis gets bigger and gets harder, and that way it's easier to have penetration, and it might be easier to feel sensations as well. There's also more medical options like Viagra, penile injection, or the pump. If you're really having a lot of distress with erectile dysfunction, you could talk to your doctor and find new ways to improve. Uh, but the chances are it will improve over time. So just give yourself some time to explore sexuality in new ways, and then maybe later on refocus on your erection if it's something that's really important to you. And also, it's important to know that it can lead to feelings of distress because we put so much pressure on masculinity and erection. So maybe you're kind of losing a sense of who you are just because you're losing your erection. But just know that it is a vicious cycle. And the more you have distress about it, the harder it'll be to get back your erection. So maybe break the cycle by seeking help. It could be with a sexologist or a psychologist, or just really your doctor, and then it'll break the cycle. And even if you get just a tiny bit better, the chances are it'll get better, better, and better. And then next up is related to vaginal dryness or pain during penetration. Um, like I keep on saying, it's to try something other than penetration. Uh, like, for example, oral sex or massage. There's so many things that you can do to uh, focus less on penetration. You can also use water-based or silicone lubricant before and during sex. You could ask for vaginal moisturizers. Some of them last for 3 days, so you don't have to always reapply them. And you can be more spontaneous because it lasts for the whole 3 days. And it's really, really important to communicate. Because by continuing to have painful sex, your brain's really gonna associate the pain with sex, and then the pain will get even more important and even your desire, like I said before. So if you're really having pain, do not force yourself to have sexual relations, thinking that the pain will go away, because it might not, it might get worse. And you can also try to use painkillers before, even though you're not sure if it's gonna hurt or not. You can always use painkillers to prevent. And if you're dealing with a lot of pain or a lot of distress about it, consider seeing a sexologist to see if there's something that you could change about your sexual relations. Sometimes it's something that you do that has a lot of impact, but you don't necessarily realize. And sometimes it's so easy to find solutions that could help a lot. And then there's a few tips on related to incontinence during sexual intercourse. Most of the time, incontinence is more important in the evening because your muscles are more loose. So maybe focus on having sexual relations in the morning instead of the evening. And like I said before, you can identify the time when incontinence is more frequent and prioritize the periods when it occurs less often. You could reduce alcohol consumption because it makes you have more incontinence. You can also try the penis ring because it not only does it keep the blood inside of the penis, but it also puts pressure on the urethra, so it makes you have less incontinence as well. And you can also try to some exercise to strengthen the pelvic muscles, either by looking online some exercise or seeing a physiotherapist, for example. And you could try to have sexual relations in the shower, the bath, or on a towel. Just be creative on finding new ways that make you feel more comfortable. There's also people who are dealing with sexuality related to wearing a stoma. So it's possible to use an envelope or non-transparent protection to hide it during sexual relations. You could always empty it and adjust it before to make you feel more comfortable. You could secure the bag with adhesive tape. You can also keep some pieces of clothing to hide it if you feel like it's making you uncomfortable, or you're just only focusing on that part of yourself when you're having sexual relations. You can try different positions as well to put less pressure on it. And maybe think about avoiding spicy foods or foods containing garlic, and adding something to your environments that mask potential others if you're scared of the other person smelling anything. There's also bags designed for these moments that you can find online that are smaller and more convenient. And it's also possible to have sexual relations in the shower, bath, or in a towel, once again, if you're scared of making a mess, or just covering the smell or anything, if you have any if you're scared about anything that makes you uncomfortable. So that's it for the tips, and now we can go to the discussion. And also, if you want to talk about your situation confidentially or more individually, you can always write me an email on that address so that we can talk together about your own situation. Thank you.
Great. Thank you so much, Emmanuelle, for that information. I'm sure you've answered many of the questions that the attendees have, but I would love to still jump into the Q&A session. So you can type any questions into the chat and I will read them out to Emmanuelle. So first question, how can I maintain my sexuality with a permanent catheter?
So it's still about body image, I'm guessing, and maybe about the fact that it's making you less comfortable. Maybe try talking about how you feel as well, and try new things like keeping the clothes, for example, or being in the dark, or really getting some time by yourself to deal with how you feel about your body and exploring how you look, and maybe trying masturbation or messaging your own self as well. That's something that could be interesting.
How can someone overcome the fear of getting a UTI after sexual intercourse?
So I think that if you're scared of getting an UTI, maybe you should talk to your doctor to see if it's something that is important or not, and to see what your doctor proposes, and then also talk about your fear and see what you can do with it with your doctor. Yeah.
How can I feel comfortable after sexual activity if part of my vaginal wall was removed during bladder removal surgery?
I think all of the questions really come back to just trying new things, and if it hurts, maybe just to focus on intimacy, getting hugs, getting massages, uh, getting deep conversations, and really giving yourself the time to reconnect with the others and find new ways to respond to your sexual needs or your intimate needs without necessarily having to have a whole sexual relations if it's something that hurts for you.
Okay. Um, and in some bladder removal surgeries, a large part of the vagina can be removed. So, do you have any recommendations on how and when you can inform a new partner that there cannot be penetration?
I think it really all depends on when you feel comfortable with that person. Maybe get to know them a little bit. Don't put too much pressure on having to disclose everything about your intimacy right away. When you feel like you can really trust them, or if it's something that you want to put right away so that you don't get hurt as well, that's something that's possible. Really see how you feel. I think it's really a case to case. There's no magic answer to that question. Just know that a lot of people don't, for example, like lesbian couples, or a lot of people don't practice penetration and have so much fun being together and so much fulfilling a fulfilling sexual life as well. So we do put a lot of importance into these aspects, but a lot of people are really happy with just being connected with someone else and being intimate and feeling close to them, even if there's a lot of things that they cannot do anymore.
Why would my sexuality decrease since a diagnosis?
There's a lot of treatments that have an impact on your sexual desire. It could be because you're taking hormonal therapy, which increases progesterone, or it could be just the anxiety, the stress. It could be the fatigue. It could be the chemotherapy as well. There's so many things that could have an impact. So it's hard to find really just one cause. And sometimes it's just all of it together. It could be also a vicious cycle. The less desire, the more anxiety, and again and again.
Okay. When dating, again, this is similar, but when would you share intimate information around having a stoma, female body parts removed, things like that? Again, any idea of when would
Mhm.
be a good time to disclose something like that?
I think it's really a personal decision. Maybe like think about what would make you feel more comfortable, because there's no real answers to that. It could be right away, like I said before, or it could be when you feel comfortable with the other person. And most of the time, it sounds like such a big problem for you, and it is huge, but people, like some people will react badly, of course, but some people will be really there for you, and people will just still want to get to know you, even though there's things that are different.
You may not have the answer to this, a data question, but wondered if you know, or if you know where we could find this. Someone asked if there's any data on divorce rates after a bladder cancer diagnosis or a cancer diagnosis.
No, I don't know the rate, but like I said, there is couples that get closer and there's couples that get more conflict, but it's even if there's a lot of conflict, there's so many things that you can do to reconnect. Like I said, you can always go consult and just focus on your relationship and take time to be together without having a caregiver relation, or seek help, talk to people around you.
Mm-hmm. Thank you so much, Emmanuelle, for your presentation and answering all of the questions tonight. And thank you, everyone who attended this session, and I hope you have a wonderful evening.